Good.
All right. Welcome, everybody, to the Health Transformation webinar. This is Cade Archibald. Really excited to be with you guys. And we got Regan here. Regan Archibald, amazing functional medicine practitioner, acupuncturist, and founder of East West Health and your Healthy Self programs. Regan, how you doing?
Really good. How you doing?
Doing amazing. Just really excited to be here and learn some really cool stuff today. We're going to be touching on real solutions for fibromyalgia.
Awesome. Today is the day. So fibromyalgia is something we've treated consistently over the years. And we had a few people that just emailed questions about it over the last couple of weeks. And I said, well, let me show you how we're treating fibromyalgia now versus maybe what it was like 10 years ago, because it's changed dramatically. And Cade, you've worked with patients with fibromyalgia. And what are some of the most common complaints that you hear come out of their mouth?
Chronic pain. It hurts.
Pain. Yeah. Yep. There's 18 major pain points that you can identify on a person with fibromyalgia. And those pain points can be very debilitating, not only for them individually, but also for their family. And you'll hear some of our stories about patients who have been able to overcome this. So I'd really encourage all of you, if you're listening to this and if you know of someone who has fibromyalgia, send them a text, send them an email, whatever it is, whatever form of communication, and tell them to get on this so they can learn that there are ways of actually recovering from fibromyalgia. So let's dive in. First of all, one of the things that we've had to combat 10 years ago, the biggest thing that I noticed is fibromyalgia was not taken seriously. Doctors would say, oh, well, we don't even know if fibromyalgia exists. There was a big article published in the Journal of Rheumatology, and they found, well, there's no inflammatory markers that would indicate any chronic pain levels in people with fibromyalgia. So therefore, it doesn't exist. And in medicine today, we say what we can't measure, it doesn't really exist. But what we're learning now is that fibromyalgia, not only does it exist and you can find it in the connective tissue, but you'll start to even see it as you use functional ranges for labs, which we talked about last week in our Healthy Self program and Health Transformation. But you'll look at those labs and you'll be able to narrow those down to functional ranges, and you'll actually see that there's many imbalances. So just because you've been told that your tests indicate you're in the normal range, but you've got this chronic pain, you're chronically tired, there's probably something going on there that you need to get checked out. So right now, 1.5 billion people on the planet suffer from chronic pain. Cade, if you look at that, you're better at math than I am. We got 7.5 billion people. What percentage of people suffer from chronic pain? Can you I'm going to guess that's like 15%, 20%. Oh, he's getting the math going. So you guys are going to know exactly what percentage of the people on suffer. So
you said there's about 7 million.
There's
7 billion.
7.5 billion people on the planet. I think 7.7 is the exact number right now. Obviously, we're like expanding in our populations in some countries. Other countries are like it's a vacuum; they're shrinking quickly. So
yeah, it's like 19.5, 20%.
So 20% is way too many. And if you look at it, fibromyalgia is one of the most common chronic pain conditions you have. In the United States alone, it's 10 million people that suffer with it, and about 3 to 6% of the world's population. So if you take that 20%, we'll just say 5% of that, of the population who struggles with chronic pain, it's like 1 in 4 people who have chronic pain are struggling with fibromyalgia. 75 to 90% of the people who have fibromyalgia are women. So this is something that is real. No matter how many doctors have told you it's not real, it absolutely is. And we've investigated a lot of different approaches to this, a lot of different causes. But let's talk a little bit more about what the disease is and what it ends up being. So people who are in chronic pain, the very next thing that happens to you is you get this prescription. 76% of visits to the doctor end in a prescription. And some of the most common prescriptions for fibromyalgia that I've seen over the years are drugs called Lyrica, Neurontin. You can get put on gabapentin. And then the most common is a drug called Cymbalta. And Cymbalta is actually a drug that is an antidepressant, but it also works on the pain receptors. And for some of our patients, Cymbalta has been a nice bridge and for a temporary fix, but it's not provided the long-term solution, because whenever you start depending on a medication for your health, that's when your health starts to decrease exponentially. And so one of the things we've looked at for years is, well, how can we help these patients who have these chronic conditions like fibromyalgia, who other doctors don't even take them seriously? How can we get their health regenerated and restored? And so that's what we're going to actually talk about today. Now, some of the symptoms. Most common symptom is lower back pain. You're going to have this 63% of people who struggle with fibromyalgia. Some of the manifestations are going to be lower back pain. This is 63%. Frequent headaches. This is 47% of the people who have fibromyalgia. Arthritis will show up in 46% of them. Muscle spasms in 46%. Tingling. So you can almost feel like you've got a nerve sensation. And we've ran the nerve conduction studies on our patients with fibromyalgia, and their nerves show no problem. They're all functional from that single test. And so you can see why doctors would say, it must not exist, but all it means is it's not neuropathy. Balance problems, irritable bowel syndrome, numbness is 44%, chronic fatigue is 40%, bloating 40%, depression 40%, anxiety, sinus problems, tooth disorders is 32%, restless leg and 32%, tinnitus, so that's the ringing in the ears, is 30%, jaw pain is another 30% or 29%, bladder problems 26%, and rash is 25%. So one of the very first patients who is heartbreaking to see, you're going to hear the rest of her story at the end, but she came to me after she'd been bedridden for 25 years. And I remember when I first saw Sandy, I was like, man, what a life. You've raised 5 kids basically from bed. She would get up in the morning just long enough to get the kids out the door. So exhausted, she'd go back to bed. And she would constantly show up with these rashes, with numbness, with bladder issues. She could not, her diet was so dialed in. I mean, any exposure to gluten would send her off, and this was before gluten was a big thing. And she had balance problems, but slowly over time, I started to get her healthy. And so, but man, just what she dealt with for the majority of her life was devastating, because her body could not tolerate the medications that the doctors were prescribing. And so she had to go to alternatives. Not only was her husband skeptical, I remember getting grilled by him many a times, and he was a professor. And so I would just say, hey, look, we're just trying to establish some balance and equilibrium in her body so her body can start to heal itself. And he didn't really like that. He liked the medication route, but the medication just didn't work for her. So I know many of you're struggling with some of these same symptoms. And here's some of the regions in the body where you're going to show up with some of these chronic pain areas in fibromyalgia. So you can have it on the front of your neck. You can have it on the upper edge of the chest. So these are points we call window to the sky in Chinese medicine. And they can be on your stomach meridian, your large intestine meridian, or even on your endocrine meridian called the Sanjiao. You can get it on the upper part of your chest. This is lung 1. This relates to the lungs. So a lot of my patients with fibromyalgia, they have a hard time really breathing and opening up. You can also get it right here on the elbow. And so this is a very powerful point for the immune system. It's on the large intestine channel. And then you can get it on the up above the patella. So, Cade, you know when Dad used to squeeze our leg and kind of like make a squirm up there on that muscle? Yeah. That's right where fibromyalgia will show up.
Ooh.
So, so don't squeeze someone who you think may have fibromyalgia. Just ask them, is that a tender spot? I've had some of my patients who they go to a doctor and the doctor pushes on all these spots, and then it sends them into tailspin for about a week. So be easy on your patients with fibromyalgia. For those of you, I know there's practitioners on this today, and good to have you on. Base of the skull, you're going to feel it right there. This is your gallbladder. This is also a point called on myon, which means peaceful rest. And the last thing someone gets who has fibromyalgia is peaceful rest. You can get it on the neck or on the shoulders, and then you can get it on the upper or outer buttock, and then the hip pain. Those are kind of the main central features for fibromyalgia. And you just remember, like 63% of fibromyalgia sufferers are going to have the low back, and it's not going to be one area. It's just going to be kind of radiating in that entire region. You can have fatigue, sleep disturbances. Your memory is not working as well. Your cognitive issues. You can be dizzy, these headaches, the skin issues. I mean, there's so many different facets to this disease called fibromyalgia that it's no wonder that people just throw their hands up and they say, well, let's just get them out of the office as quickly as we can. But we want to see what's actually really at the root cause of this. So if you look at the cycle of fibromyalgia, there's something that occurs in almost everybody. And so there's an increase in substance P. Substance P can also contribute to hyperactivity in the nervous system. So you can be more prone to pain. You'll have an increase of nerve growth factors. So it's almost as if your nerves are depleted. And so your body's trying to regrow the nerves, which can indicate some of the, and contribute to some of the numbness. You can have increased nitric oxide, which is actually a really good thing if you're really trying to recover from a workout and get better blood circulation. But it's also one of those areas that for chronically increased nitric oxide, you can end up with massive amounts of pain. The other side of the increased nitric oxide is an increase of lactic acid. And then finally, in fibromyalgia patients, you're going to have an increase of interleukin-8. And interleukin-8 can be one of those drivers for chronic pain. And then what you'll see on the back end of that is an increase of tumor necrosis factor and an increase of interleukin-6, which are chronic drivers of arthritis. The backside of that is poor sleep. So anytime you have poor sleep, that's going to cause a decrease in serotonin, a decrease in growth hormone. And Cade, what happens when someone has a decrease in growth hormone?
Your ability to recover, your drive, a lot of things just start decreasing significantly. Yeah, strength goes down, sleep.
Yep. Yeah, you don't burn fat as well without growth hormone. You don't have the release of stem cells, so your body can't regenerate. Stem cells really do well with a lot of growth hormone. And then the third thing that happens with fibromyalgia patients is there's a decrease in adrenal function. So this is where people feel like they're walking through sludge. And the decrease of adrenal function means you're not getting the secretion of cortisol at the appropriate times. So there's nothing to clean up the mess. So it's almost like your body just stays in this toxic state. And then the increased fatigue, what you'll find is the decrease of energy, decreased exercise. You can't recover. People will say you just need to exercise, push yourself more. And so my fibromyalgia patients will push, and then bam, they hit a wall, and then they end up with chronic fatigue on top of the fibromyalgia. You'll have joint stiffness, decreased movement, muscle atrophy, joint degeneration, and increased pain. So really, I look at fibromyalgia, and if you lump all these together, and if you think about what the number one killer is, what is that one condition that kills more people every day? It kills 100,000 people every day. Cade, can you think of what that one condition is that really looks a lot like fibromyalgia?
Aging.
Aging. You nailed it. Aging.
Yes.
All right. Cade is the next contestant on the Price is Right. The number one killer is aging. And if you look at the factors that are going on in a person's body, what we can measure and what we know in fibromyalgia, those same factors that are diminished or increased are the same factors that show up in aging. So very interesting. So think about this, are you tired of the pain and the poor health that fibromyalgia has caused you? How is fibromyalgia affecting your life, your relationships, your ability to work? how many of you out there are wondering, I wonder if I have fibromyalgia? Maybe this is why I feel like crap all the time. I'm in pain all the time. And maybe there's some answers out there for you. So if there is, you've got to ask yourself, what is the cost of doing nothing? Because look, everything in life replenishes itself. Money replenishes itself. Time replenishes itself. But you cannot replenish your health. I mean, that's the thing. When you're waking up day after day and your health is still depleted, you can't turn back the clock and just go and get those days back and get that energy back. So one of the most important things you can do right now is figure out, do you have a problem and is there some help out there? Because that's what I'm going to shift to now, is to find out if there's, to see what solutions actually are out there that can alleviate a lot of these fibromyalgia symptoms. So Cade, any questions before we move on?
No, no questions at this point.
Okay, so I'm going to share with you just a few patients. This is one of our patients, Chris, and excuse me there. Chris is a patient who came in who had chronic pain, the back pain, the knee pain, all the classic symptoms of fibromyalgia, just never diagnosed with it, just told like, here's another pain medication. But what Chris said is, from the moment I stepped through the door at East West Health, I was met with genuine, professional, knowledgeable, and concerned people. Every aspect of the process was explained and performed perfectly. In short, I could not be happier with my decision, and I am confident that because of their work, my life has been dramatically changed for the better. So let's jump in. Number one, we got to get the right test orders. So we got to look at your inflammatory markers, your blood glucose. A lot of our fibromyalgia patients end up with anemia. And then we want to look at heavy metal toxicity. So one of the first things you can do if you have some of these symptoms of fibromyalgia is start eliminating heavy metals from your life. That means drinking from aluminum cans. There's been a prevalence of high levels of aluminum in our patients who have fibromyalgia. So that would be one area that you can start with. Look at your blood labs and look at your hemoglobin A1C. And we want that hemoglobin A1C to be 4.9 to 5.3. If that thing is out of range, it's going to be really difficult for you to have the energy and have the ability to fight back when it comes to fibromyalgia. The second thing you want to look at is your C-reactive protein. You want to make sure your C-reactive protein is very low, like under 5 on your inflammatory markers. And then look at homocysteine, because what we're discovering is a lot of our fibromyalgia patients have high levels of homocysteine, which is another inflammatory marker. And now let's talk about treatments. Some of the common medical treatments out there is what I've mentioned is the drugs like Cymbalta, or you look at gabapentin, you look at some of our fibromyalgia patients actually get on opiates. And just last night, my wife and I were having a conversation about the opiate crisis, and we're reading this article about an anesthesiologist who ended up like bringing some opiates home and ended up injecting herself on it. She said, yeah, the very people I was helping get off these drugs, I became the addict and the doctor. And it was a really kind of startling article about how quickly she got hooked on this stuff. And she just got to the place where she'd do more and more and more. And her husband actually started like checking her duffel bag when she'd come home from the hospital to see if she didn't sneak some, because some of the nurses started noticing that the medication was missing and then suspected that it was this anesthesiologist because she had full access to it. And so we got to end this opiate crisis. But one of the things that this article talked about is the fact that 130 people every day die from an opiate overdose. Right now, if you are 50 and under, the number one cause of death is drug overdose, and usually it's opiates. And so this is really crazy because obviously aging is the number one cause of disease, but if you're under 50, it's this opiate crisis. So this is where we looked at fibromyalgia and we said, what are some other options out there? And for years, I would use acupuncture, Chinese herbs. We would use functional medicine, different testing, and work on lifestyle and just slowly building up our fibromyalgia patients. That process would take 3 to 5 years to really get a person to, a low level to a high functioning level where they could go back to work, they could enjoy their life, they wouldn't have these crazy episodes where they're in bed for weeks at a time, they wouldn't catch every cold that came past them. And this is where we changed, is when we started saying, I wonder if stem cell therapy could help some of our patients. And so one of the first patients we treated with fibromyalgia was Lejean, and she has scoliosis, and she had chronic pain everywhere. And, one of the things that she wanted help with was just better memory, more energy, and less pain. But pain was the biggest thing that was just sucking the life out of her. And so we said, okay, let's see how it does. And you'll hear her story in a minute, but when you put stem cells into the body, the very first thing that happens is it reduces inflammation. But really the way it does that is it turns off these chronic aging molecules like IL-8, IL-6, TNF-alpha, all the things that are elevated in our fibromyalgia patients. It turns these molecules off. It brings new cellular growth, and it helps regenerate a lot of those connective tissues that are being impacted, some of those 18 major areas. And so what we also find is that with about 50% of our patients who have fibromyalgia, they also have arthritis. And so this is a way that we can reverse the arthritis. And then stem cells will self-replicate. So they will continually bring new energy into the body. So it's like resetting the immune system and bringing new life into the body of our patients. And so I think stem cell treatments for fibromyalgia, not only is there research going on that's very favorable, but the other thing that it does is it makes sense because it's a natural way of bringing new life into a body that's in this aged process. So we use young cells from the perinatal tissue, from placentas, umbilical cords, and the blood serum. And combined, you'll get better blood circulation. A lot of the scar tissue will be eliminated. And then you'll get new life brought into your body with these new cells. And so if you look at Lejean here, she was diagnosed with fibromyalgia 15 years ago. And then after she received her stem cell transplant, we did use donor cells with her. We used the umbilical cord and the stem cells that we got from Utah Cord Bank. And we did it in her, we injected in some of her affected areas, in her neck and in her spine. But not only that, but we did an IV, and her condition improved tremendously. And so her pain levels now are at least 80 to 90% gone. She's got pretty severe scoliosis, so I don't think that it's going to be possible to eliminate her pain altogether. But just the fact that she's gotten that much better has changed her life. And so now she's on no medications, which means her brain's working better, her liver is going to be a lot healthier, she's going to age slower. And then now she receives acupuncture for maintenance, and the acupuncture is far more effective than it was prior to the stem cells. Sandy, the patient I talked about in the beginning, she was diagnosed with fibromyalgia 25 years ago, bedridden most of that time, like I mentioned, raising her kids. I was doing acupuncture, herbs. We're trying to slowly coach her through this process. We helped her lose about 50 pounds. Not only that, but her pain levels have reduced so dramatically. She was out of bed. She's been out of bed in the last 2 years, but now she's able to travel all over the world. Her husband retired, and so their kids are all gone, and so they're able to travel and really enjoy their time together. It's certainly given her life back. And so this is some of the ways that we can start combating this. If you get the right treatments, you get the right approach with fibromyalgia, then you don't need to be stuck in bed all these years. And so acupuncture, there's many benefits to that. There's many benefits to stem cell therapy, but we found that combining the two with proper nutrition and proper coaching, that's helped a lot of our patients just completely uncover this health that actually exists. And so, Cade, I mean, maybe you've got some stories down there in St. George, but anything else you could, talk about when it comes to our patients with fibromyalgia? Any tips you could give them or advice?
Yeah, I think just like what you were saying, if you can reduce the inflammation in your body, so, some of these treatments can be life-changing and just complete game changers. But if you're looking at how you're treating your body, what you're doing, reducing inflammation, so eating a really clean diet, avoiding any food that's going to cause an increase in toxicity or any sort of inflammation or response. Look at getting getting your gut tested. So do some stool testing, look at what's going on in your microbiome, also looking at, how your hormones are responding, how your adrenal health is. So get some of those additional deep dive testings done, because if you're just basing it on some basic blood work that you get at your doctor every quarter, you're typically just going to continue to get worse and worse unless you really do something about it.
Yeah. It's going to be kind of a superficial Band-Aid at best. And so yeah, I appreciate that insight, Cade. Some of the foods that we found that can really impact our patients with fibromyalgia are diet sodas. So I know a lot of you are addicted to your Diet Coke, your Diet Dr. Pepper, whatever it is. Get rid of those. Get rid of any sweetened cereals. Any flavored water, a lot of these flavored waters, any of these artificial sweeteners are really going to flare up your fibromyalgia. Chewing gum is a big problem with fibromyalgia too, because once again, you have gut issues, and that chewing the gum helps stimulate your enzymes in a way where you don't need them. You're not actually eating food. So get rid of the chewing gum, get rid of the powdered drink milk, and then dairy products and gluten can be very damaging for our patients with fibromyalgia. So hopefully this has given you some insights. I know, Cade, we're coming to the end, but when it comes to like really looking at an overall plan, there is a path out there. We have some of the most talented people here at East West who've helped thousands. We've had over 60,000 patients come through the doors of East West in the last 15 years. And we really are on a mission. Our goal is to end pain and chronic disease for 1 million people by 2025. And if you look at fibromyalgia, there's so many of you out there who are suffering in silence, and you're just slugging through the day. And some of you are in denial and you think, I'm tender in those areas, Regan. And my digestive system, sometimes it works, sometimes it doesn't. My energy's not quite where I want it, but it's not as bad as that person, or it's not as bad as Sandy, who you talked about, or Legine. Don't hesitate to, don't procrastinate. Don't put your health off. That's kind of the mission of the day, is to get you to do something different about your health so you can get your life back. So really appreciate you guys being on this. Appreciate our awesome Instagram people and Facebook, and then our webinar folks as well. So love you guys, and give us a call or visit our website. It's acueastwest.com. And we'd love to help you out.
All right. Love you guys. Have an amazing day. We'll be here same time, same place next week. Bye-bye.
Bye-bye.